Hi, I'm Dr. Doug Campbell. I'm the Medical Director of the Neonatal Intensive Care Unit at St. Michael's Hospital, Unity Health.
And I'm Philomena Mefe. I'm the head of the Department of Obstetrics and Gynecology at St. Michael's Hospital and an obstetrician gynecologist practicing here.
We're super excited to be able to provide a virtual tour to show where we are and probably more importantly, show where we need to be. So we're excited to take you through a patient journey as they walk through their experience of having a baby at St. Michael's Hospital.
So you can imagine when our patients are entering our unit, they are escorted into the waiting room. But currently the waiting room is a pretty standard kind of waiting room. And what we really like is a waiting room that is inviting and comfortable to our patients, and probably most importantly, connected to the healthcare providers. So the communication between patients who are waiting and our healthcare providers is linked. This is our triage area where patients are coming to be assessed when they are arriving to our unit. And as you can see, it's pretty cramped. There's curtains between the different beds. It really doesn't give us much privacy, and it's also not very safe, especially now in times of COVID, where we realize how important it is to have private areas when we're doing our patient assessments. So really, for the safety, the dignity, and respect of our patients, we really need an area that is larger than this, that allows us to have individual private rooms for patient assessments.
This is our current neonatal intensive care unit. It is right in the middle of the 15th floor, located between our labor and delivery unit and the postpartum unit. In fact, being on the same floor as where mothers are cared for before and after their baby is critical to families. It is one of the attributes that makes us stand apart in the whole city of Toronto and frankly in Canada. But we need to do a bit better. Our new space, which will also be on the 15th floor, since that is so critical for us, will have private rooms where we can deliver high quality, critical care to fragile newborns, as well as having the heart of the NICU, or that shared space where families can learn from each other and learn how to get ready for their babies to go home.
Welcome to our neonatal resuscitation room. This is where sick babies come to receive the intensive care immediately after they're born. The space is adequate for the year 2000. It's certainly not adequate for the year 2021. Today, for example, triplets are being born. We only have space for 2 premature babies. We need more space. And not only do we need more space, we need high technology to deliver the best quality of care possible. We're proposing to put the OR black box into here. That would be called the NICU black box, first of its kind in the world, so that we can deliver the best education and the highest quality care for those fragile newborns who need it at the most critical times of their lives. We need this now.
We are now in the neonatal intensive care unit. Family integrated care is critical to the success of our babies and the health of our babies, both short-term and long-term. Although families are allowed, and St. Mike's values that, the space is not always adequate because there are times when you need privacy and more people to provide the critical care for your baby. This is why the modern day version of NICUs need to combine private rooms and shared space such as this one that we're in now. Care is what our babies need, and we're delivering it now, and we can deliver it even better in our new NICU. We are now walking towards the new NICU space on the 15th floor of the Peter Gilgan Tower. It's exciting because it's a new space, it's a brighter space, it will contain all the elements of family integrated care that we need. And probably most importantly to new mothers, it's on the same floor where they're receiving their care. So they know their baby is safe and cared for, and more importantly, nearby. We are now in a private patient room, which is going to be very similar to one of the private rooms in the brand new neonatal intensive care unit. This space will allow the caregivers to provide the highest quality care to the smallest, fragile, sickest babies in Toronto. Families can spend 24 hours a day here to be closest to their babies at a time when they need it the most.
What we are envisioning here at St. Michael's Hospital in particular is to have the kind of space where a woman who is in need of critical care doesn't have to be shipped off to the intensive care unit or the cardiac care unit, but can actually remain on this floor in a high dependency unit, which will facilitate us monitoring her more closely and at the same time have her baby right next to her. Now we know that this is so important. It's important for maternal healing, well-being, and also for babies. Babies thrive better, they feed better, they sleep better, they gain weight better if they are next to their moms. Thank you in joining us and making this campaign a reality.
We are so close to making this new space happen. We couldn't have done it without you. Thank you again.
Thank you.